over the past decade, the National Institutes of Health and hundreds, possibly thousands of scientists, including Dr. Anthony Fauci and Dr. Francis Collins, received more than $350 million in private, non-transparent royalty payments from third parties in the scientific, research, and healthcare industries. Now, this information comes from an investigation by the organization OpenTheBooks.com. It's a project of American transparency that obtains and posts all disclosed spending at every level of government. So what can we learn from these findings? Joining me now to talk about this is Mark Tapscott. He's the Capitol Hill correspondent at Epoch Times, who first reported this story. Mark, welcome to Washington Watch.
Thank you, Joseph. It's great to be here. How are you?
I'm well. This is a great story, interesting story. Tell us a bit more about these payments. Why are people at NIH receiving royalty payments of any kind?
Well, that's a great question. And in fact, it's probably the question at the heart of this, because the NIH is being very, very closed-mouthed about who is making the payments. They have not identified the payers. And they are also making it very difficult to learn anything but the most general details about who in the government receives the payments and for what. And I have to tell you, there was a congressional hearing that I covered the day before yesterday on Wednesday, where Congressman John Molinar from Michigan asked the acting director of NIH, why isn't this a conflict of interest? And the acting administrator conceded. He said, well, yeah, I can see how that has the appearance of a conflict.
Yeah,
Yes.
Mark, we actually have a copy of that. And just so people can catch up, let's go ahead and play that clip and let our audience hear the exchange so they know what you're referring to.
Do you not see that as a conflict or an appearance of a conflict of information?
I certainly can understand that it might seem as an appearance, but and it's the sort of thing that maybe we could work together on so that we can explain to you the firewalls that we do have in place.
So, Mark, these payments, and I want to clarify something. This is not money that's coming from healthcare companies or outside sources that is going to fund research at NIH. This is going to the personal bank accounts of people who work for NIH. Is that correct?
Yes. And a good part of it is it's a classic Washington bureaucracy. The company makes the payment to NIH, which then makes the payment to the individual. And that's so that they can say the income is not coming from an outside source, but rather from the government. But, you know, as Congressman Molinar said, that's the very essence of a conflict of interest.
And so right now, of a conflict. So right now there's a record of these payments going to NIH, but we don't know who they're coming from. Is that correct?
Exactly. NIH knows, but the rest of us don't.
And the concern, therefore, would be that the people giving this money to NIH, which is finding its way into the personal bank accounts of the people running NIH, they might have some influence over the decisions that they might be making, correct?
Exactly. Open the books. They filed a Freedom of Information Act asking for all of this information. NIH didn't even respond to it. So Open the Books took them to federal court, and a judge said, "Hey, you can't ignore them. You've got to give them this." So they are now slow walking the production of the documents that have been requested. It's classic Washington.
Well, what's the outcome of this going to be? How long has it been since the judge said you must turn this information over?
A couple of months, and they have so far produced several thousand documents that cover the period 2010 to 2014. And the $350 million figure that you mentioned at the outset is Open the Books projection for the whole of 2010 to 2020. So, and I'm sure if anything, it underestimates what's the actual total is.
Are there any dots that we're expecting to be connected in this? Is there other evidence that suggests we think we know who's making these contributions to NIH that are finding their way? Or is this just a big mystery? It's a question.
Back in 2005, the Associated Press was able to obtain a great deal of information about these royalty payments. Back when they were about $9 million a year. Now they're apparently about $35 million a year. But they got the names of the people who were doing the paying, and they were predominantly pharmaceutical companies. And that makes sense. You would expect that.
That's not shocking, but no. It's also troubling because we just went through 2 years of probably the most public example that the country has ever seen of how pharmaceutical companies have an interest in policy decisions made by the federal government. And of course, they made, I don't know if it's hundreds of billions, but many billions in the COVID response to things. What do you think the result of this is going to be? Is there something that Congress can do? Because this seems so obviously problematic that federal employees working at a federal agency can personally benefit from additional funds above and beyond their personal salaries. Is there a desire and interest in Congress to cut this off, to make sure that obvious conflict that would be created by that no longer exists?
Well, I haven't talked to every member of Congress yet, but the ones that I did talk to in my reporting across the board, they all said, wow, we've got to look into this. We need to investigate this. Now, all of those that said that were Republicans. I tried to get comments from a number of Democrats, and they had no comment. So if something is going to be done, it probably won't be done in this Congress, but I would be very concerned about if I was working at NIH and getting royalties, I'd be really concerned about 2023.
Well, this is one of those things that feels like it should be bipartisan, that you don't want public servants publicly or personally benefiting in a financial way from the decisions they make as public servants, because that's just the opposite of serving the public when that's happening. Yes. And I can understand why the Democrats at this point would be protecting their own because it does look bad, but I've got to think everybody's going to come together eventually and make this stop. Mark Tapscott, thank you so much for your time today.
You too, Joseph. Thanks a lot.